All right, let's go ahead and get started. Good morning, all. My name is Chloe Nicksic Sigmon, and I'm the Director of Research at VXVY Mental Health. I'm a clinical psychologist by training, and at VXVY, as you'll learn today through my talk, I oversee a lot of our research efforts, which heavily focus on implementation. So that is what I'm here to talk to you all about today. And in particular, implementation in real world settings and specific factors to study as you roll out implementation and how you can increase engagement. So, the main goals of the talk today are to talk about research on digital mental health and distinguish the differences between clinical trials and real world trials and when might be appropriate situations for each. And then we'll talk more about real world implementation in particular and the benefits that come along with real world implementation trials, in particular, understanding user experience and increasing engagement. And then we'll wrap up the talk today by me walking through examples that our team has completed around implementation research. So we have half an hour today, have a lot of information to go through. Probably will use that whole time going through the slides, but I'm very eager to respond to questions or comments that you all might have. So please feel free to reach out after the presentation. You'll see that I've included my contact as well as the contact information for the full team at the end of the presentation. So just to start out on a large scale, kind of bigger picture, oftentimes when we think of digital mental health, we might only think of one or two of these factors, such as mobile apps or telemedicine, but really wanted to orient you all to, as we're talking about implementation studies, that we can think about digital mental health in a much more broad context. And so including all of the things here in this graphic and not necessarily limited to just one of the or two of the more common things that we would think of. So wanting to talk about research in digital mental health and really making the point that is an explosion of technology in the mental health field right now, right? It was increasing over the past decade, and then particularly during and post-pandemic, this has become a multi-billion-dollar industry. And unfortunately, most of the tech out there does not have research behind it. And research is one way to distinguish products and to help users vet products and to help understand quality and to help understand user engagement so that the tech can be scaled and can be sustainable and used over time. We all know those apps that we have on our phone or other technology that we try that we get really excited about initially, and then after a week or a month, it's just something that we don't use anymore, right? And so the research is a piece or a way for us to understand engagement and make modifications so that we're getting high quality tech and so that we're maximizing engagement in a sustainable way. So really wanting to start out by distinguishing clinical trials from real world implementation. Oftentimes when we think about research, we think directly about clinical trials and all of the structure and control that comes with that. And there's definitely a place in terms of studying efficacy and effectiveness where clinical trials are needed and necessary and absolutely the most appropriate research design. And I also wanted to spend some time highlighting the benefits of real world implementation. So you can see from this chart here that clinical trials are all the things that you would typically think of, right? Screening and eligibility criteria require an institutional review board approval process, include a comparison group. The main point is to track clinical outcomes, like looking at does this product reduce depression or anxiety, or what are the key outcomes that people expect to see from using the product. Typically require a large sample size in order to be powered for the statistics that are conducted as part of the study. And then a benefit of that is having large scale generalizability of being able to make claims about how well the findings, how likely it would be in other settings beyond the study setting to hold true. And then, of course, publication, which disseminating findings and showing evidence of the digital mental health can be a really appealing aspect, because if you have evidence that it works, of course, you want to showcase that because it's something that can distinguish you from other tech products, right? But if we look in this real world implementation column here, you can see that there's more flexibility. There's some pros and cons to this, right? There are some things that a real world implementation doesn't offer. It can limit the generalizability of findings, but there's also a lot of ways the flexibility can be a benefit. So depending on the study design and the scope of how you want to generalize the findings, IRB approval may or may not be required. If it's more in the program evaluation for a specific setting or quality improvement effort, oftentimes IRB approval would not be required. It's not typical to have a comparison group in real world implementation because you're looking on a smaller scale and more pilot study setting. And I think the biggest benefit to highlight then is that it focuses on engagement outcomes. So it's very common for real world implementation trials to look at feasibility and acceptability, both of which I'll go into much more detail in a few minutes. But it is very common for engagement to be the focus of real world implementation. And if you think about it, this is key because in order to look at if the digital mental health tool does what it says it does it reduce depression? Does it increase well-being? Does it reduce anxiety? We need to make sure that users are engaging with the tool the way that it's intended. Are they using the product as often as is necessary to see a benefit? Are they running into barriers that make them cut off their use halfway through? And so understanding the engagement is key, and that's one of the major benefits of real-world implementation. And then because it's more focused on pilots and understanding the engagement, not as large of a sample size is needed, and yet there's still a place for publishable findings, whether it's a white paper or a peer-reviewed journal or on a company's website. There's definitely still importance of disseminating the findings professionally as well. Another thing to keep in mind when you're thinking about clinical trials versus real world implementation is that order matters. So this screenshot is a graphic from the Burkhead and colleagues article on VR research, but it also applies, I think, more broadly to digital mental health in general. And so it outlines kind of the steps and the process from a development and research perspective. So you can see the first step is really focused more on the development stages. So if you look at VR2 and VR3, these are highlighting the importance of doing early testing that's focused on engagement, feasibility, and acceptability before you move into the randomized controlled trials to look at efficacy or effectiveness. And the idea is that you need to make sure, can I do this? Is this model feasible? Does it work? Will users engage before you can measure, does this work as it's intended to work? So it really is there's a key piece to understanding the implementation prior to the efficacy. Okay, so then when you're looking at engagement and when that is your focus, what do you want to look at? How do you measure that? How do you understand it? So feasibility and acceptability are two key factors that we look at. And so we'll go into what each of those are and how they're distinguished from each other. So feasibility is thought of more of kind of a systems perspective. So the degree to which this technology or this product can be integrated within the system. And so when I say system, it could be if it's a workplace wellness tool, how well does it fit within the existing structure of the workplace? If it's a tool that's rolled out clinically for patients in a clinical setting, how does it fit with the other treatment that they are getting? If it's something that needs training in order to have users engage with, who's doing the training and how does that fit within, like, are there people trained that are easily accessible to help roll out with the implementation? So feasibility is an iterative process. It's something you want to keep your eye on routinely because as you come across barriers that get in the way of feasibility, you make modifications, come up with solutions, and then reassess the feasibility, right? A kind of quick and dirty way to measure feasibility is looking at the frequency of use. Are users engaging with the tool? If so, you've worked out some of the kinks, right? Like it's fitting into the system in terms of people are finding time and ability to access the tool. So really the main goal of feasibility is to identify any operational barriers to use from kind of that root cause level and then develop solutions that will enhance effectiveness or frequency of use. Acceptability, then you can think about more on the individual user level and then the aggregate of that. So what are users thinking about the technology? Are they willing to use the technology? If it's VR, are they willing to, have a headset on? Are they, if it's a mobile app that they're supposed to use during work, are they willing to use that during their work time? What factors get in the way of willingness? What aspects about the technology itself do people like and what do they not like? What creates a disconnect versus what factors make them want to engage more? So you can use standardized scales about satisfaction or usability, but acceptability is also commonly assessed using focus groups or semi-structured interviews as well. And you'll see in the examples that I walk through that our team has conducted, we use a mixed methods approach so that we have both quantitative and qualitative data to kind of get the full feasibility acceptability picture. So benefits of understanding feasibility and acceptability. So if you take the time to go through all this effort to design a trial that will help you understand these factors, what's in it for you. So it'll give you a very clear picture of what clients like and don't like about the digital mental health. It'll help you understand what barriers are getting in the way of use. Maybe they love the technology, but something about the experience of using it is too long, or maybe they don't have good Wi-Fi in the location that they're set up to use it and they need Wi-Fi. It gives you a deeper understanding of barriers, a deeper understanding of what factors actually facilitate use and make it easier. And then it will set you up for future research. So looking at efficacy as a next step, you can be confident that if users are engaging with the tool as intended, that if it's evidence-informed, high-quality content, you're more confident that you're going to get the actual desired impact. People are going to report feeling more mindful as a result of using it, or feeling less depressed, or more engaged, more focused, depending, on what the tool is. And then it sets you up for the next stage of research if that's something that is in line with goals. So then a little bit more specifically in terms of assessing feasibility, and this slide is broken down both in how you would assess feasibility, both within a research setting and a research trial, as well as what kind of questions can you ask to assess feasibility, just on kind of a one-on-one or like more programmatic implementation effort outside of the context of research. So in research, you might be asking yourself, am I able to keep participants in the study? Is my attrition rate low? In a more clinical or just application setting, you want to know, will clients keep using the tech? Do they try it and use it only one time and then they're done? Does use decrease over time, or are we able to maintain use over time? In research, you might ask, will participants do what they're asked to do? Do they complete all the questionnaires that they're being asked to do? Do they check in with study staff? Do they use the tech as frequently as they're being asked to? And then in a more application setting, you're also wanting to pay attention. Do clients use the tech as it's assigned? Are they encountering barriers to use? And if so, what are they? And then finally, can the treatment be delivered per protocol? So if the protocol involves a lot of assessment before and after to understand pre-post outcomes, or if it requires many steps, or if it has to be used at a certain time of day, let's say it's a tech that is supposed to help facilitate sleep and it needs to be used right before bed, are participants able to stick to the protocol that's designed when engaging with the technology? And then in that more kind of direct application setting, are they using the tech as frequently as requested and in the manner that's requested? And so understanding these questions and actively asking users these questions will help you get a better idea of barriers and what's working well. And so you can see that you can make adjustments then based on the information you get to actually increase use and engagement. So from, excuse me, from the acceptability angle, again, we're wanting to understand user experience, their willingness to use tech, what they like and don't like. So just asking direct questions. What do you like about the digital mental health? What do you dislike about the specific digital mental health tool? What would make you want to use it more frequently? And what what impact are you experiencing? So this is getting at, in some ways, like the effectiveness or efficacy, but from an acceptability angle. If you're using a VR mindfulness tool, as you'll see from some of our examples, what impact are you noticing? Do you feel more calm? Do you feel more focused? And what's that subjective experience? Because if you're noticing an impact and it's in line with the goals, right, users are much more likely to have continued willingness to use the technology. And again, you can use this information right away to make modifications to increase engagement. Acceptability questions can also be really helpful during the development stage of technology. So I'll circle back to that in one of the examples that we go through too, because if you can, from the tech development perspective, if you can modify features or aspects to make it more in line with what users like, then obviously that can help increase engagement as well. So this slide is stepping back a little bit back to the bigger picture. I pulled this screenshot from a paper that our team published last year and focused on implementation and feasibility and acceptability. And so you can see that this model is designed as kind of a big picture framework for rolling out digital mental health and interventions. So on the first step is to understand the needs of the setting in which you're rolling out. So you want to consult with tech companies, you want to consult with the organization or the setting in which the technology is being rolled out to really understand what the needs are and to make sure that the technology that you're recommending is actually a match with the needs of the organization and that the technology has evidence-informed content. Right, so that's step one. Then once you've selected the technology, you're in this pilot study phase, right? And this can be, the very much more formal pilot study that is IRB approved and structured and regimented in terms of assessing outcomes, or it can be a much less formal kind of QI or program evaluation effort as well. But within this pilot study phase, you're looking at acceptability and feasibility and to understand that on a much deeper level. And as I mentioned previously, our team really favors using a mixed methods approach because getting both the quantitative and qualitative data, it's getting just much more kind of 360 view, right? You're able to understand adherence, retention from a deeper level, as well as getting direct, kind of more open-ended feedback from participants. And so taking all of this information in a package to get a pretty thorough and complete understanding of what factors are advancing engagement and what could possibly be getting in the way of engagement. And then as kind of a final step of this, figuring out what the next step is. So do we continue to roll this out? Do we scale it? Do we look at conducting an efficacy study? What is the next step from there? So just, excuse me, before I go into our specific examples, one kind of last note on pilot trials. I've used that term a few times throughout the presentation today, and just wanted to highlight that pilot studies really are a critical step in this research and implementation process. So skipping the pilot and going straight to a large-scale clinical trial is a mistake because you miss the use and engagement data. And you can really use that use and engagement data as a way to structure the design of the larger study to maximize your engagement. While pilot trials, I would argue, are an essential step in this type of research, they're also really easy to misuse the purpose of pilots or to make conclusions in a way that is not effective and that can actually hinder your research. So for example, pilots should not be used to estimate effect sizes because you're still working out the kinks of use. You're still making modifications to increase use and engagement. And so, if your use is low, then maybe your effect size in the pilot is going to be pretty low also, but then you notice a larger effect size as you increase engagement, right? If you use that low effect size to estimate the sample needed for a randomized clinical trial, then you're going to be conducting a much bigger sample, needing a bigger sample and adding to the budget, and right, so that's not useful. So pilots should not be used to estimate effect sizes. And then they also should not be used to draw conclusions or pervasive conclusions about efficacy. So you might be able to see trends and you might be able to feel confident in the direction. It's definitely worth it to measure clinical outcomes. One, because you're assessing if your measurement process in the trial is a feasible and acceptable measurement process to use in a randomized controlled trial. But also you're keeping track of what's happening with the outcome. What you don't want to do is make sweeping conclusions then about efficacy during a pilot trial, because again, you're still working out the kinks of use and engagement. So really that's where the spotlight should stay. All right, so finally wrapping up then with a few examples from our team of studies that we have conducted over the past couple of years. So the first is a VR mindfulness study that we conducted at a medical campus. And so it's a college wellness study, and just one caveat in there is our sample was residents and fellows and graduate students all at a medical campus. So maybe a kind of more stressed, busier version of students. And so our goal for this study was to evaluate the feasibility and acceptability of VR mindfulness, looking in particular at stress and well-being and mindful awareness as outcomes. And so the data presented on this slide are from a research symposium poster presentation that we gave last year for just the first 8 participants of the study. And then we actually have completed data collection now. We're in the process of writing the study up for publication in a peer-reviewed journal. So you can see on the right side of the screen in the gray box that we did measure the key outcomes that we were looking for. So stress, well-being, and mindful awareness. And so we have evidence that this measurement process and keeping participants engaged enough to complete the measures we were asking was feasible and acceptable. And then you can see from the scores, we are seeing trends in the direction that we would hope. So we're seeing a reduction in perceived stress, we're seeing an increase in well-being, and we're seeing an increase in mindful awareness. So this is all, positive initial data that we're also not going to draw broad sweeping conclusions from. And then on the left, you can see quotes from our semi-structured interview around acceptability. So people reporting that they noticed feeling more calm and disconnected from stress, that they were able to use it as something before going to bed. That one participant preferred a focus content because it was a shorter content. So potentially for this population, the shorter content fit from an operational feasibility stance, fit better into the structure of their schedule. They found that it was not boring, and also the auditory pieces were helpful in inducing peace and calm. So all of this is helpful from both a content and how do you fit this into your life perspective, and will set us up to do a efficacy trial if that is something that is a good fit in the future. Another example with VR mindfulness was in a substance use context. So this is a phase 1 small business innovation grant that is designed to be a pilot study. And the intervention was a combination of VR mindfulness and substance use recovery, like peer recovery app that involved peer community support. And so it was the combination of these two types of technology, which is labeled recovery, as you can see in the slide here with the outcomes. So participants were given a VR headset while they were in a substance use residential program, and then upon discharge took the headset with them, and then were also connected with a mobile app for this peer recovery piece. And so you can see that through the study, we found evidence of feasibility, acceptability, and usability, again, setting it up for it to be appropriate to do a randomized controlled clinical trial. But the kind of key piece here that we learned is in implementation, we made some adjustments to implementation that increased engagement. So we found that the more time time we spent thoroughly orienting participants to the VR while they were in the substance use program was helpful. And then if we structured the engagement so that they had their certified peer coaching appointments scheduled prior to their discharge, this kind of organization and building it into the discharge plan increased engagement upon discharge. So this is an example of where understanding the barriers to engagement and making modifications can make a substantial increase in engagement and really set you up to be able to study efficacy. And then finally, this last example is an example of looking at engagement during tech development. So we are working with one of our VIX members, You Flourish, who have a LGBTQ plus wellness app that they are preparing to launch. And we are gathering information from users about the different features of the app. So we're conducting focus groups to understand feasibility and acceptability at this early stage so that feedback can be given to You Flourish based on what would make users want to engage more, what users like the most, things that might find confusing or things that potentially could be barriers to use, so that when we analyze this data using qualitative data methods and then provide feedback and recommendations back to You Flourish, they can use this information to make adjustments to the features of the app itself prior to the initial launch to help increase engagement that way. So in summary, I know I threw a lot of information out at you all today. I think this kind of bullet points to leave you with the awareness that most digital mental health has not been evaluated via research, but this is actually a critical step for understanding quality and impact, and that both clinical trials and real-world trials are essential parts of this process in the vetting of digital mental health. And real-world implementation is something that is absolutely key to understand and improve user engagement and set you up for the most realistic clinical trials, but also in a non-research setting, real-world implementation sets you up for maximizing user engagement and therefore any benefits that come from the technology use, maximizing sustainability and continued use of the digital mental health over time, and maximizing potential to be able to scale the technology as well. So thank you so much for listening to the talk today. You can see my email is at the top of this list here. I've also included the link to our website, and this particular link is to our team. And so you'll see when you go on the website that anybody that you click on, you'll be able to access their email address through their bio as well. And then finally, I've included the link to our LinkedIn. So if you don't follow us already, please go ahead and check us out and give us a follow. And then just one final thought, I just wanted to highlight that members of our VIX network can access mental health resources and information related to implementation, feasibility, and acceptability through the member portal. So again, thank you so much for your time. Please feel free to reach out with any questions or follow-up comments or feedback, and I look forward to hearing from you. Thank you so much.